Hi, my name is Anthony Polcari from Metro Urology, and I'd like to talk to you today about the metabolic evaluation for kidney stones and review with you the instructions on how to complete this evaluation. As you probably already know, kidney stones are painful, inconvenient, and costly to deal with. Unfortunately, without treatment, up to 50% of patients will experience a second kidney stone within 5 years of their first stone event. The good news is that treatments aimed at preventing kidney stones can reduce the risk of another stone forming by about 75% and thus reduce the need for future hospitalization, ER visits, and surgery. There are several different types of kidney stones and multiple risk factors for each stone type. Our goal is to figure out your unique risk factors for kidney stones and specifically tailor our treatment plan to address those risk factors. The way we do this is through a process called the metabolic evaluation, which involves 3 different components. The first is the stone composition, or type of stone that you have formed. We gain this information by sending off stone fragments that are retrieved during surgery or by analyzing fragments which you have passed. The second is a blood test aimed at identifying medical conditions which are associated with kidney stone formation. The third, and probably most informative, is the 24-hour urine collection. Simply stated, kidney stones are crystals that form from various salts found in the urine. The goal of the 24-hour urine collection is to figure out what in your urinary environment is causing these salts to develop into crystals and then grow into stones, rather than staying dissolved and being excreted in the urine without difficulty. In the next section of the video, I will review specific instructions on how to collect the 24-hour urine specimen. It is important that you follow these instructions very closely. The specimens are very sensitive, and we would hate for you to go through all the effort to collect the specimen if we cannot interpret the results. Your doctor may order 2 complete collections, and in general, 2 collections are better than 1. If you would like, you can complete these collections on 2 consecutive days. For example, if you have a weekend free and you'd like to do 1 collection on Saturday and the next one on Sunday, that's great. Just make sure that you use a separate collection container for each 24-hour specimen. On the other hand, if you'd like to, say for example, complete 1 collection on Tuesday and the next one 2 weeks later, that is perfectly acceptable. The results of the test are indexed to a 24-hour period, not longer and not shorter. Therefore, it is very important that you collect all of the urine that you make during that 24-hour period. Even 1 or 2 voids, either over or under collected, can skew the results of the test. During the time of the collection, we would like you to keep your normal diet, fluid intake, and activity level. Please do not alter your diet unless you're specifically instructed to do so by your doctor. We really want to understand what is going on in your urinary environment under real-life conditions. This is the container that you will be given for the urine collection. It is very important that you write on the bottle with permanent marker your name, date of birth, date and start time of the collection, as well as the date and end time of the collection. The collection can be started at any time. We would suggest 7 a.m. or when you first wake up in the morning. To start the collection, go to the bathroom, empty your bladder, and flush this void. This will be the official date and start time of the collection. This way you are starting the collection with a clean slate. Mark this date and time down on your collection bottle with a marker. From this point on, collect all of the urine from each and every void into the container. Again, even 1 or 2 missed voids will skew the results of the test. At exactly 24 hours after the start time, empty your bladder and make sure you collect this void into the container. This is the official end time of the test. Using the marker, write the end time down on the container. Next, screw the lid on tight and gently turn it over to make sure that it's not leaking. Then, hold the container upright and make sure that it's refrigerated while it's being stored. There are 2 ways to submit your collection. The easiest and most reliable is to simply return your orange collection container to any lab at a Metro Urology location. The lab at our Woodbury office is open from 8 a.m. to 5 p.m. The laboratory sites at our other locations are open from 8:30 a.m. to 4 p.m. These containers must be returned within 24 hours of the collection. Otherwise, the urine cannot be interpreted. It is important that the collection container remain refrigerated during the entire collection process. The simplest way to do this is by storing it in your refrigerator. However, if that is undesirable, during the winter months, you can store the collection container outside. It is okay if the container freezes. Alternatively, you could store the collection container in a cooler filled with ice. Again, please make sure that your container is labeled appropriately with your name, date of birth, start and end times of the collection. Unfortunately, we cannot accept unlabeled specimens because it can lead to errors in patient identification. The second way to submit the specimen is to take a smaller sample of the larger collection container once the full 24-hour collection is complete. If you do this, we would like you to first mark the volume of the full collection by using the ruler on the side of the collection container. It is important that you place the container on a flat surface and measure the lowest point of the fluid level that you see according to the ruler. Take this volume and write it down along with your name, date of birth, and collection date on the small collection cup provided in your kit. Once you have recorded the volume, take some urine from the larger container and pour it into the smaller collection cup and fill it to about 90 cc's. You can see that there is a small sponge inside of the cup. It is important that you leave this sponge inside of the cup in the urine. This sponge is a preservative and it makes sure that the urine is interpretable once it has been received. When using this small collection cup, make sure that the lid is screwed on tightly, as we do not want the urine to leak during the shipping process. Once you've made sure that the cap is screwed on tightly and that the appropriate labeling information, including your name, date of birth, collection time, and volume, is placed on the cup, place the cup into the bag and place the bag inside of the box. Once the specimen cup has been placed inside the box, please place the box inside of the FedEx bag provided. Then apply the prepaid packaging label onto the bag and call 1-800-GO-FedEx to schedule a courier pickup. It is very important that you schedule this pickup immediately after the collection has been prepared. Next, I'd like to review some common mistakes and reasons for rejection. It can be frustrating for the patient and the provider to have an improperly or mislabeled specimen such that we cannot interpret. One of the most common reasons for a rejected specimen is improper labeling. It's very important that you write your full name, date of birth, start date and start time, end date and end time, and for the small collection container, you must write the full volume of the collection on this container. Another common question is what to do if you completely fill the container prior to the end of the 24-hour urine collection. Once you have filled one container, get the second container that was provided to you and stop the collection after 24 hours. Both of the containers will then be submitted together for that 24-hour period. If you had to use 2 containers for one 24-hour urine collection, please call our Stone Clinic coordinator at 651-999-7055 and we can provide you with 2 more containers for which to use for your second collection. Another common mistake is submitting a specimen that is too old. Again, if you are going to submit your specimen in the orange containers provided and return these to a Metro Urology clinic location, these containers must be returned within 24 hours of the collection. Otherwise, the urine cannot be interpreted. Oftentimes, patients report that when they bring their collection containers in, that they missed 1 or 2 voids. for example, if they were out running errands. Unfortunately, the results are indexed to a full volume of urine for 24 hours. Therefore, even 1 or 2 missed voids or 1 or 2 extra voids will make the specimen uninterpretable. Another issue that we commonly face is that patients return specimens which have not been refrigerated. It is very important that you keep the specimen refrigerated from the start to the end of the collection and while it is being stored prior to bringing it in to the lab for evaluation. Sometimes patients will return the specimen to a location other than a metro urology lab. For example, patients may bring the specimen into their primary care providers. It is important that you bring the specimen back to a metro urology lab location, as sites other than a metro urology lab will not be able to process a specimen. Finally, body fluids or waste material in the collection container other than urine will make the results unreadable. If you have any questions, either prior to starting the collection process, during the process, or afterwards, please call us at Metro Urology at 651-999-7055. This is the phone number for our Stone Clinic coordinator who can help you through any questions or concerns. Thank you for your attention to this video. Our goal here is to help get the most accurate results possible so that we can help prevent